Is it dying?
Okay. She's got catheter, so we'll do catheter care first. Okay. Okay, if you're practicing skills for testing, do you want this on there?
No.
No. And I'll tell you why. Look how many steps are connected to this bed protector. Read it and tell me how many steps are connected to this bed protector.
None.
If the bed protector is already here, what is your student likely to do?
Use it.
Use it and not put it, right?
Yeah.
So
It's already there.
It's already there, so they may not put one. If they don't put one, what happens?
They won't take it out.
They can't take it out. If they don't take it out, can they dispose of it?
No.
No. So you got a whole cluster of stuff that's tangled up in this pad. So be sure when you're practicing that we're practicing for testing purposes. No, I should say that all your protectors are out.
Right.
But I know exactly why she had that one, because she's teaching real world stuff. Right. And we're gonna pull her top sheet down. Okay. Sharon, she got a call me or just
Not on this bed, because
Okay,
this
that's
is
all
my
right, that's
public
cool.
health fundamentals bed.
All right, that's
so.
fine. That's cool. That's fine. All right, Miss Mannequin. My name is Agnes, and we're gonna have you got a tattoo?
She has a place on her chest that we use for measurement in biomed tech, but
She sure does have a place.
we
on her
measure
chest.
the wound size, so
They must have pulled out a pacemaker and it went bad.
they did a boo-boo, didn't they?
I'm gonna go get my stuff, and I'll be back. But we're gonna wash that catheter up a little bit, okay? Okay.
Sure.
Alright, so let me get my stuff. This is one that they dread, but it is actually one of the fastest ones to do. Oh. That's it. What do you want? I'm just gonna do it. Thank you, ma'am. And I'm gonna get two. I got two washcloths and one towel. And gloves in my pocket and soap. Yeah, that would help. Now, is this exactly what they got to have? No. Whatever, gets the job done, but I'm saying that you can do it with two rags and one towel. And my gloves. And a little water. I'm checking the temperature of the water. Right. I checked it. The other half is that she checked it. Miss Mannequin, how's that feel?
Oh, it feels wonderful.
I thought you would think so.
Mm-hmm.
I'm glad you do. Okay. This is on the wrong side for me. I'll tell you something else I've noticed. They don't know how to move equipment without banging and beating everybody. However, I think the people who actually take training are far, far better than those who challenge. The ones who challenge, heaven help them. Phew. Alrighty there, Miss Mannequin. We've already checked the temperature of the water. We would pull the curtain for sure. Be showing her cookies to everybody. You can pull it up from the bottom or down from the top. It doesn't matter as long as you're maintaining her privacy. And remember that the interpretation I got was shoulder down to mid-thigh. But to do this, you're going to have to expose a little bit more than that. But if it makes you feel better, it would make me feel better. Will you throw me something? I don't care what it is, towel or anything, that's fine. Thank you, ma'am. You know, just anything. All right, now. But you get the idea, right?
That's hilarious.
And the evaluator would get the idea.
Let me have the mink stole over here. We'll put it over here.
Anything to cover you up, girl.
Bath blankets were wonderful. Yeah.
Yeah, we used to have bath blankets. Now it doesn't matter as long as they're covered.
Mm.
Well, we got 'em.
But bath blankets are still cool, though. All right. Now, it says I must put a barrier. And so I am going to put a barrier under her. And I know it's wadded up, but you know what? This is testing, and she ain't going to be there very long. All right, there's the catheter. We are going to meet at the meatus. We're going to meet at the meatus. Last year, the book said near the meatus. This year, the verbiage is at the meatus. So that's a little change from last year. Not near it, but at it. So some conversation like this might be helpful. Miss Mannequin, you're going to feel me touching you at the bottom because I have to hold your catheter to be sure that we don't do anything to hurt that. I'm touching you now. I'm at the meatus. Meet at the meatus. Now for testing, this is all you need. One swipe for soap. That's clean water, right?
Mm-hmm. Must have not been a clean dishcloth.
I must have had some soap in
must have had some soap
a
in
previous
there.
life.
The laundry is
I'm
not
gonna
doing
be
a
touching
good
you
job,
down
are
here.
they?
You'll feel me touching you. Meet at the meatus. Dry. You'll feel me touching you. I mean rinse and dry.
And dry.
Now how long did that take?
That wasn't bad.
So no 3 swipes.
For testing, 1 is enough.
Okay.
If you want them to do 2 or 3, they can, but I've come to the conclusion that the less variables there are to give them opportunity to screw up, the better
Yes.
off they are.
That's true.
Because
Until
it
you're doing-
says if they do more than 1 swipe, it must be a different part of your rag. Now you've taught them clinically that they're going to wipe until the brown is gone, as I've said before today. But here again, if you want to use this quad thing to get a different part of the rag, you know, it's very easy to do, but 1 wash, 1 rinse, 1 dry, move on.
That
With
makes
this
it
when
much
you're
easier.
doing catheter care, you're not doing peri care, so
Correct. Good
big
point.
difference.
Very good point. And so when they go for testing, tell them, we realize in real life if you do one, you do both, because they're all at the same corner. But for testing purposes, they're separated.
Mhm.
So don't get involved in doing both. That happens a lot. Saves, I mean, it just burns up a lot of time.
Would they ever get put together?
Ma'am?
Like, would they ever
In
get those skills
testing.
together in testing? Have you ever seen
Uh,
that?
Yes, on occasion. Wait, no, wait. No. I've seen the pair, one of them have cath and one of them have peri, but not two.
But not the same person
Mhm.
having both in the skills.
No.
Okay.
Okay, all right, Ladybug, let me give you your call bell. There's your call bell. Okay. And I got to clean my mess up here. And I didn't raise her bed, so I'm not going to lower it because the default is in a low position. So unless somebody fooled with it, we all right.
Normally what would happen, since I do in facility, the mannequin gets moved onto that bed.
Mhm.
So they don't have to pretend over here, so the mannequin goes over there, because I've asked about that. The mannequin gets put over there as the last skill of the set, and so the call bell is there, the curtain is there. It's like the person has jumped in the bed, so.
Right, and that's another reason why the evaluator may go out of order a little bit, because if there's 2 people that have got peri-care, sometimes I will put them to, not peri-care, but something that needs that mannequin, I will put them together so that the peri-care is going to be the last one of somebody's skill, And then the next person, I may ask them if they're comfortable with it. After they do hand washing, can they go ahead and use the mannequin, then I only have to move the mannequin one time. And if they're not, that's okay, we won't. But if they're okay with it, then that eliminates moving that mannequin. Because some of them weigh about 150 pounds. That can kind of get you. Okay, so we're gonna put this in the trash. We're gonna put this with our dirty stuff over here. Dirty laundry. We're gonna empty, rinse, dry. I emptied, I rinsed, I dried. Woo! Man, I was just chunking water everywhere. And if they were to do something like that, don't worry about it. It happens in real life. What do you do in real life?
Clean it up.
Keep going. And then the evaluator will probably say, that's okay, keep going, I'll get it. But just so I won't bust my Tahuchi, I'm gonna move it. Dirty designated area. I got trash in my hand, so I'll just put that in the trash can. And I wash my hands. I'm gonna go back and double check that call bell and open her back up. Oh, I forgot to move something here. This is not tremendously dirty. I'll put that back there. Okay. Y'all good with that? Did I leave out anything?
I have a question about, somewhere in the remote past or maybe recently, when they go from doing something with a real person
Yes.
to the mannequin,
Yes.
that the evaluator will tell
Ask them
them
to-
to sanitize their
Right.
hands.
Right.
And
That will be in the instructions, and it's also, it'll be in the verbal instructions, it's also in their little green book. So they don't even have to worry about that. You know, you can tell them, they can read about it, but it's not scored, and it's just for infection control. So that you're not taking germs from over here to over there, and I didn't do it a while ago. I should have, and I didn't do it a while ago.
Well, I just know
Good-
sometimes
good
kids will
conversation.
panic because they'll think that we've
Absolutely.
forgotten to tell them that.
Right.
And it's not necessarily part of the skill like you say, but
Right.
they come out and they're just all shook up and, you know.
It's in that green book, I don't know what page it's on, but here again, that's
This was in the curriculum where I printed this off,
Mhm.
copied it with curriculum. It's also on the top of every one of these little,
Mhm.
it's the decontaminate hands or whatever. That's in the curriculum.
God, y'all okay with that one?
So what if they take the soap to the dirty? Are they okay? If they
Yes,
just
that's
take
fine.
everything to dirty?
Yeah, they can take the soap over there or put it there, it doesn't really matter.
Okay.
The main thing you're looking for are those pieces of equipment and linen. Anything that would classify as linen, anything that classifies as equipment, and paper stuff, because paper in some occasions is used for, linens. There's a lot of test sites that have disposable washcloths and disposable towels, and, they're really kinda cool, y'all.
Mhm.
I wouldn't advise teaching on them all the time, but when they're doing multiple practicing, that's pretty cool stuff. Because sometimes there's regional test sites that use them just to keep from a mammoth laundry.
We're using them.
I've just kinda taught my students to put everything in the
Dirty supply.
Yeah,
that
but
they
their
don't
linens
come-
are gonna have to go in.
Yeah.
in-
Yeah.
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 Good.
Yeah.
Because you
But like that
can,
hand stuff, don't bring it back over here, just pay everything
That's
over there,
fine.
then that way they don't have to think.
That's right.
That's kinda what I was
Goes
doing,
where?
so I was like, is that okay?
Yeah.
Mhm.
because you can have the basket on the end of the dirty supply, and they're throwing their linen in the basket, and they're putting the other stuff on the stretcher is what I call it, and it's in the right place and you've sorted it.
And most of the time there'll be a dirty wet and a dirty dry, and we all know that dirty is dirty, you know, clinically speaking. But testing speaking, the reason we do that is so that the dirty dry can be recycled. Because they're not sick, they're not patients, they have on their clothes and their skin's intact, and we're just trying to keep the site going, and if you give out of stuff, you can't keep it going.